So we're very interested in advancing the research in Fragile X syndrome. Of course, this syndrome is a rare condition in neurology which doesn't have any therapeutic options available. And part of the challenge in developing therapies for Fragile X syndrome is that there aren't very standardized tools that we can assess kind of the impact a potential intervention can have in a family member, in a patient, or somebody who has Fragile X syndrome. So what we've created is a thorough review of the literature, what's been done in previous Fragile X trials, and pulled together something that really incorporates the patient perspective and family perspective early on in creating this kind of visual analog scale, and then correlating that to what's important from a clinical symptom perspective, from a caregiver, as a clinician perspective. And so part of the research that we've done here is showing how interviewing individual family members who take care of their loved one with Fragile X, what's important for them, identifying which three, let's say, behaviors or symptoms or activities that are most important for them when it comes to taking care of their child. And then that's kind of part one. And then part two is asking our clinicians to correlate what those important areas of interest are with a clinical measure. And then by doing so, we've created a scale, let's say, that's specific for this population with Fragile X, which could be applied to other neurological disorders as well. But in this situation, you have a visual analog scale, or VAS, where the patient's kind of their own control, and you can measure improvement or not improvement by different points in time. So this really informs our ongoing studies as well. We have an ongoing study called Rocket, which we'll be reading out later this year. And this is part of that study where we are using more traditional scales that have been used in Fragile X, such as the Aberrant Behavior Checklist, the ABC, and the ABC FXS, which is the subset that's specific for Fragile X syndrome, but also incorporating the visual analog scale to see how we can validate that measure within the study itself. So I think this is an important step forward, because it's not only that it's applicable for Fragile X syndrome and research in Fragile X, but it can be adapted to other conditions using a similar approach, similar methodology, which will help, I think, other researchers kind of advance the fields in their areas of interest as well.